So you woke up one day, looked into the mirror, and then saw one, two, three, or even more birds on your chin. Then you wonder where are they coming from? Like you nearly scream, is this a spiritual attack? Or maybe you've even been working on those chin hair for many years now, every week you pluck on them, and then you still ask yourself that question: what is happening to your body? Let me tell you something. You are not the only one in this shoe. And it is not just all about hormones. So carry your chair now, sit down, and pay a close attention to this video because I will tell you why some women grow beards. What does it mean? And most importantly, what you should do about it. See, no shame here, no sugarcoating, just the real truth that you can understand. I am the star nurse, your go-to nurse for health gist that is simple, smart, and straight to the point. So let's get started. Why does this happen? Like, why is the facial hair coming out in the first place? You see, facial hair in women has a medical name, hirsutism. That's the spelling, hirsutism. And this is why it might be happening. One, hormonal imbalance. That is when testosterone level is high. You might be wondering, maybe it's men that used to have testosterone. Do women have it too? Yes, women have some low level of testosterone. But you see, the moment that testosterone level is getting high, the moment they start to increase, then it can cause hirsutism. You may start having birds, you may have chest hair, back hair, all those areas where men do have hair. You too will start to have it there, and there are many things that can cause it. For example, PCOS, that's the condition. Certain medication, maybe you take some medicines, and menopause. So these are the related hormonal causes of hirsutism. Two, polycystic ovarian syndrome. This condition is very common in women of childbearing age. That is when you enter the stage of giving birth. And when there is polycystic ovarian syndrome, it usually comes with irregular periods, pimples, that is aching, then difficulty in giving birth, infertility, and from there, it starts growing birds. Three, family history. You can say genetics. Your grandma may have had it, your auntie too. And in some ethnic group, they used to be more hairy naturally. They just have hair almost everywhere. Either you're a man or you're a woman. Some ethnic groups are used to that. Four, medications. That is when you take some medicines often. For example, you take steroids, anti-seizure medicines, or hormonal drugs, then you can be susceptible to hirsutism. Five, menopause. When a woman reaches menopausal stage, then naturally, just naturally, their estrogen level will drop and then the testosterone level will increase. What do you expect? They can start having these periods. Six, thyroid disorder. When a woman has a thyroid problem, either hypothyroidism or hyperthyroidism, it can throw off their hormonal balance. Like it can just change the game of their hormones. And hirsutism may be a part of the things that can be disturbing. So let me tell you a mini story. For example, I once met a patient who was using family planning injection, and then she starts noticing birds. It turns out that her hormones were a little out of balance. There are some cases whereby you use family planning injection or drugs and your body will not be having it. Like it doesn't just correlate with your body. In her own case, it was this bread growth that she started noticing. And when she checked with her doctor, they were able to adjust the drugs and then the hair reduced. Listen well, it is not all facial hair that means that something is wrong. But you should start to worry, start to be conscious when you notice thick hair suddenly growing on your chin, on your chest, on your stomach, on your back. Pay attention. When you start to have irregular periods or you don't even see your periods at all, you have sudden weight gain, you don't know where the weight is coming from, you are just having weight gain, your voice start to deepen like men's own, you start having aching, like pimples full your face. That is your body trying to tell you something. So you don't have to take a mirror and start plucking one by one and assume that it is normal. It is not normal. Go to the hospital, get a proper checkup, go for blood test, for hormones, go for pelvic scan, for PCOS, go for thyroid test, all the kind of related tests that can make things clear to be on the safer side. And remember that early diagnosis is equal to what? Sharp solution. Alright, so what should you do? What can you do in order to solve this problem? Go and see a gynecologist, my sister. Go and see a gynecologist or endocrinologist. Just get to the hospital and see the right people. They will check for hormone tests. They will take you through PCOS tests needed, thyroid tests, just everything to make things work. Then two, you need some lifestyle changes. Lifestyle changes that can help to fasten things up. You need to reduce your sugar, processed food, and even your weight if necessary. Eat more fruits, more vegetables, more lean proteins, food that are healthy. And most importantly, manage stress. Manage stress. You see cortisol. Cortisol is a hormone that worsens hormonal imbalance. So you don't want to have it. Try to manage stress by taking breathing exercise, normal exercise as well. Try to relax, reduce just anything that will be stressing you, your mental health, your body, reduce them. Then stop over plucking. You see all this plucking. It will not help matters. They will damage your skin and even worsen ingrown hair. So it's better you can go for waxing or even see a dermatology for approved methods. And then don't self-medicate. No buying of all these hormone drugs from chemists without doctor approve. Don't buy medicine. Don't let all this TikTok influence or pressure you. Don't let it harm you. Face your own health by yourself. This is a very sensitive topic for a lot of women, and I brought it here because no one should be ashamed of what their body is saying. You are not a man. You are not less feminine. You are human and your body deserves attention. Let me know in the comments, have you ever experienced this? Or do you know somebody who has? What have you done? What have they done? Let's keep learning. And then like this video if you gain a value. Of course, you gain a value. Subscribe to the channel to follow me and then share this video to at least 5 people you care about. Why not? And please don't forget, your health is my mission. So please keep thriving.